Does joining support groups for cystic fibrosis help?
Yeah, till few years ago, because the disease was not diagnosed and there were not many patients, the parents were taking care of the babies, buying all the medications, and there was no uh, say information available about the details of this disease. Then people saw that once the number of babies were increasing, number of children with cystic fibrosis were increasing, then they saw that there are certain other conditions also for which there is a parent support group. Specifically, if you see thalassemia, if you see other rare diseases, hemophilia, and so on. So then doctors like me encourage families to make a group, and then they can help each other to begin with by helping each other, by increasing the awareness, and then increasing the awareness by education. Then in we encourage the group of parents with cystic fibrosis, and they made a cystic fibrosis trust, which is registered with government of India as a society. And then now what they started for last few years, almost 10 years, they procure the medication from the companies directly. So it is almost 50% subsidized or at a discounted rate. And then it is being managed. Initially we were helping them, but now it is being managed by parents and children who have grown up with the cystic fibrosis. So they have a social these media, including WhatsApp group. They communicate with each other, and once a year they have a meeting. They buy the medication as per the order from individual patient, and then they take money and then they distribute it. There is so this is a Delhi based society, that is CF Trust. There is another organization which is much bigger, and that is the rare disease in India, organization for rare disease in India, that is ORDI, which is Bangalore based NGO, and they are taking care of CF as well as other rarer diseases, and they are doing the same or rather better services for these patients. Now the other group, other support which is started few months ago is by the government of India. That is because there is a policy for rare disease support program from government of India, and cystic fibrosis is one of the rare disease recognized by this program. So they do not provide too much of a money, but at a one time support, they give say 50 lakh rupees that can be used over a next 10 years. So 5 lakh rupees per annum, and they'll get the medication from Center of Excellence across India. And AIIMS is one of them. There may be Institute of Child Health in Chennai. There are various parts, including say some in UP. There is a SGPGI, and in Mumbai, in the KEM hospital. So these are the some of the institutions where there is a center of excellence. So the doctor concerned who is taking care of the children should be aware that such help is available from government of India free, irrespective of their income, education, or their caste and their other details. So the doctor will fill a form, send them to the center of excellence, where the center of excellence committee will screen, and if they will get it reviewed by the experts. If they feel that yes, he can be given some support, then depending on how much support has been asked, it is being sanctioned. And then the patient may go periodically, say 2 to 3 months, to the center where he can collect his medications and then come back again after 2 to 3 months.